welcome to southeastern Senegal, where the road is a little bumpy. I apologize, but I wanted you to see where we're going.
Despite recent advances, malaria continues to be a serious health issue in Senegal. Particularly in the southeastern corner, where I live, malaria wreaks havoc every rainy season, and I wanted to devote my Peace Corps service and master's project to fighting this disease. And I've since had the opportunity to take a leading role in a reimagining of the testing and treatment paradigm for malaria. In 2009, Senegal introduced a new program to address barriers to access to care for malaria. It's called PECADOM, an acronym for the French Prise en charge à domicile, or home-based disease management. Low-level volunteer community health workers were given training to test and treat for simple malaria in the village. The program was very effective at reducing malaria deaths, but the impetus was still on the sick person or caretaker to seek treatment. Delaying this treatment means that there is more time for the disease to develop complications and become fatal, and also that there is more time for a mosquito to bite a sick person and become infected, perpetuating the transmission cycle. So the design challenge is this. How can we adapt this program to address the observed lack of treatment-seeking behavior and diminish the prevalence of both complicated and simple malaria in rural villages? Peace Corps volunteers and local counterparts have created an evolved version of the program that we are calling PECADOM Plus. Here's the plus. Pay a small wage to the health workers to conduct a sweep of their village once a week during rainy season to actively seek out cases of malaria and treat them on the spot. We move from playing defense to playing an aggressive offense against the disease. During the sweep, a rapid diagnostic test is administered to anyone with symptoms of malaria, and treatment is provided for any confirmed cases of simple malaria right there at the patient's home. I have been leading a team from Peace Corps and the Saria Health District to scale up last year's mini pilot of this model to 15 villages around the departmental capital where I live and carefully measure the results. Our preliminary results are incredibly exciting. The proportion of the population with confirmed symptomatic malaria on the day of our end-line sweeps was 16 times lower in the PECADOM Plus villages than in the 15 comparison villages with the original passive model. During the project, I came back to my own site from conducting a field supervision only to witness my 4-year-old neighbor die of malaria. I had spent the day in a village that is almost impossible to access, supervising the provision of treatment to every single person with malaria that day. And here was a family who lived 5 minutes from the health center that lost their daughter because they waited too long to seek treatment, and no one came to them. This story of tragedy only highlights the importance of creating more stories of design success. I want to be a part of that larger story of fighting disease and poverty using human-centered design. The process of working with local counterparts to rethink the way care is delivered in the village context has helped me to focus my own career goals. I want to keep doing this work and make IDEO.org's Global Fellowship a part of my story.